Premature ejaculation in men, causes and treatment. The premature ejaculation causes anxiety and tension in the affected person. Ejaculation is one of the most common male problems, and any man may be infected at any time of his life. The speed of ejaculation can be defined as the uncontrolled ejaculation of sperm from the male, either before or shortly after penetration during sexual intercourse. This happens with less sexual arousal and before the desire of men in it, leading to non-satisfaction of sexual desire and dissatisfaction with sexual intercourse on both sides. Ejaculation is one of the most common forms of impotence in men. Every man at some stage of his life may have experienced premature ejaculation. What causes premature ejaculation? Most cases of premature ejaculation have no obvious cause, and with sexual experiences and age, men learn to delay orgasm. In some cases, premature ejaculation occurs, for example, if it has been a long time since the last sexual exercise, and psychological factors such as anxiety, guilt or depression can also cause it. In some cases, premature ejaculation may be due to a medical cause such as hormonal disorders or certain diseases or side effects of certain drugs. What diseases lead to premature ejaculation in men? Spinal cord injuries such as tumors and blood sacs where there is continuous stimulation of the ejaculation center. The first stages of peripheral nerve inflammation before these nerves become afflicted, and the inflammation of the nerves due to diabetes, excessive alcohol use or exposure to some heavy metals such as lead and mercury. Inflammation of the prostate or inflammation of the urethral canal causes permanent congestion in the pelvis, causing premature ejaculation. What are the symptoms and methods of diagnosis of premature ejaculation? The main symptom is uncontrolled and uncontrolled ejaculation either before or shortly after intercourse begins, where ejaculation occurs before the man wishes to do so, with less sexual arousal. It is advisable to see a doctor if the man suffered from premature ejaculation for a long time to receive the best solution for this situation, which negatively affect the psyche of men. Your doctor will perform a thorough physical examination, and some medical tests may be required to rule out diseases that can cause this condition. How is premature ejaculation treated in men? In many cases and over time there is a gradual improvement, and there is no need to worry or to receive treatment after a period disappear this situation. However, if the speed of ejaculation continues, the treatments vary between the following: behavioral treatment for premature ejaculation. The doctor may give the man and his partner some instructions on how to manage their sexual lives and try to communicate better together at the human level, and to converge together and control the factors of sexual excitement through the use of condoms to reduce the sensation of access to the penis, or through the use of certain sexual conditions such as lying on the back, and use some behavioral therapies that control the ejaculation process better. Medical treatment for premature ejaculation. The causes of premature ejaculation should be treated in the case of a hormonal problem. In the case of the cause of the man's depression, for example, the doctor describes some types of antidepressants for the patient. Medications are also prescribed to treat depression even if the man does not suffer in some cases, as its side effects delay the ejaculation, such as Paxil. Some types of creams, gels and aerosols that treat premature ejaculation can also be used by reducing the sensitivity of the penis and are used topically. Lidocaine is prescribed, although it is not recommended to use such drugs because they affect the wife as well. Exercise therapy. In some cases it is difficult for a man to control the ejaculation because of weakness of the pelvic muscles, in which case the specialist can prescribe some exercises that contribute to strengthening some of the pelvic muscles, which can better control the ejaculation and delay time. Future treatments for premature ejaculation. Some of the most effective treatments for premature ejaculation include silodosin, a drug used in the treatment of prostatic hyperplasia and is used in the treatment of premature ejaculation, as well as modafinil, a drug that treats sleep disorders and also improves the speed of ejaculation, and duloxetine. Experiment is dedicated to the treatment of premature ejaculation.